Good morning, folks. Good morning, good afternoon, us East Coasters.
Thanks so much for being here on a Friday, everybody. We're so happy to see you. Um, thank you for coming to another session of the Summer Career Glow Up series presented by Innovate Network. And today's session is one that we're really excited about. But before we get into the content of today, why a summer glow up? Why are y'all here? What is the point in joining us for the summer? So, I know a lot of you have worked with us throughout the academic year, where we've had a lot of really great sessions in terms of workforce development and a lot of those key skills that we know you all are looking for as you prepare for this next stage in your life, whether that's moving into college or preparing for an internship, fellowship, or your first entry into a career. But in terms of a summer glow up, we really want to make sure that we don't have any loss of skills during the summer, but we want to keep the flow going. So we want to continue your confidence building. We want to be able to continue to work with all of you to expose you to potential mentors, potential careers, and real world skills. We really see the summer as an opportunity, whether you are taking summer classes or
Yep.
interning, to continue to really build on a lot of those skills that we know that you're going to need as you're getting into this next stage in your life. So, really, our goal is to help you return from the summer being more confident, more focused, and even more career ready.
Yep. And for those, I see some new names and folks that are joining us for the first time. Like Cheryl said, we are Innovate Network. And again, what everything that Cheryl said is backed in our experience working with students, knowing that over the summer, right, there can be that loss and that kind of while you all deserve a rest, right? We all did the summer reset a couple of weeks ago with us. We also heard that it's really important to hone our skills, right? To make sure that we are continuing to impact our resumes, our skills, all of that. So, Innovate Network is so happy to be here for you guys and to offer this opportunity to communities coast to coast. And again, we have tons of experience when it comes to helping students navigate their career goals and how do I get from point A to point B, right? And we do that through many ways, but especially today, through bringing you a panel and folks that have been there and will give you really great advice, resources, and make sure that that trajectory, especially into healthcare for today's conversation, you've got as many tips and tricks. So, again, why that healthcare matter and why we're here for this care factor. As many of you known, as we're starting to have conversations, right? Even from this school year, healthcare is more than just a job, right? It's an opportunity to really make an impact in people's lives. Folks don't do it just for the money, the honor, all of those pieces. There is something so special, especially in our panelists, on why they care and why they want to make a difference and impact in people's lives through healthcare. But again, whether you are interested in medicine, public health, mental health, research, right? There are a lot of ways to make impact within healthcare that I don't think students think about a lot. And then there's also showing you that the pathway is not linear, right? It's not just, one way to do it. I think you're going to hear from our panelists that there's a lot of learning curves, right? And there's a lot of things that they thought were going to happen, and then it doesn't, and it all works out, and it teaches you really great lessons that they're so excited to share with each of you. So today is all about exploring those possibilities, learning from these professionals, and then also getting to ask really great questions. So, as always, I see Professor Reed is here with his classroom of sophomores who are doing the thing and making sure that they are also, participatory. So please, Dr. Reed, make sure that you give us those really great questions that your students ask in the classroom. Um,
I just also wanted to call out, we hear from a lot of students throughout the year that whether some of you are focused and know specifically that you maybe are focused in pre-med and want to go down that track, but we also hear from a lot of students who are unsure.
Yeah.
Maybe they have an interest in medicine, but don't exactly know what they want to do. And that's perfect because that's exactly why we're here today, is to hear from practitioners who are in the field who all had different pathways into healthcare. So I encourage you all to use the chat, ask questions, because we're going to get to be able to hear some different stories and different perspectives of what those pathways were like. So to kick us off, I'm really, really excited to welcome Dr. Emily Nicole Perez, who also is one of our Innovate Network board members and a huge supporter of the work that we're doing and has been working with our students throughout the year. But Dr. Perez is a board certified general hand surgeon. And I know for a lot of you maybe haven't not seen or had the opportunity to connect with a hand surgeon previously, but you'll get to hear a little bit more about her pathway. In addition to her work, she also serves as the president for the Charles Drew Medical Society. And today we have representation from the Charles Drew Medical Society as well, and other physicians who are going to be a part of our panel today. So I would like to turn it over to Dr. Perez to welcome you to the group and to introduce the rest of our panelists.
Yay. All right, I'm gonna stop sharing.
Oh, you're muted.
Okay, so welcome. I'm really excited about this opportunity. I think some of our panelists are still making their way on to the webinar right now, but I am going to start sharing my screen. And kind of just give you a little bit of a rundown. I don't want to lecture by any means, but we're excited to be here. We have all been in your shoes. Every single one of us has walked this journey. So we're prepared to take questions, to discuss whatever nitty gritty you may be interested in, but wanted to just give you a little bit of an overview of the journey. So the folks that will be joining us today, myself, Nikki Perez, it's Emily Nicole, but I go by Nikki. And I am the president of the Charles R. Drew Medical Society. And as Cheryl mentioned, I'm also a hand surgeon. Dr. Humes, Dr. Haskell Humes, he is the vice president of the society and a practicing physical medicine and rehabilitation specialist. Dr. Lang, who is family medicine, also does a lot of work with public policy and advocacy at the state and national level. Dr. Poole, which I see who is already here with us, is also in family medicine and is the president-elect of our society. She'll be taking over after me. She's involved in numerous organizations, does a lot of community service, making sure that we are engaging with folks that really need our services the most. Dr. Staley, he is an occupational medicine physician, has just retired from private practice, but has still been very dedicated to mentorship. Dr. Pyle, also an internal medicine physician, has been the medical director for several organizations, and last but not least, Dr. Hawkins, who is an internal medicine specialist here locally and is the past president of the California Medical Board. So he's been involved in overseeing pretty much all of what medicine looks like in the state. So why representation matters, why it matters that that you guys are here and you're entering the pipeline into medicine. There is irrefutable data that shows that patients do better when they're cared for people who look like them, people who understand their culture, understand the food they eat, understand their lifestyle, understand what a day to day looks like, and that that really translates into better outcomes, living longer, being healthier, being more willing to take your medication, being more willing to do the things that the recommendations that the doctors are prescribing. And so, as someone with a unique set of values, a unique cultural experience, we all bring something new to medicine. The experiences that you've had as a kid in your neighborhood, and understanding what it's like to eat in the summer from the corner store, and understanding what your culture looks like, is valuable, and it's something that we don't teach in medical school, but it is very useful, and appreciated by your patients, to understand, for them to see themselves in you. And so all of the uniqueness that you bring to your practice helps to shape what medicine looks like in the future. In addition, um, we tend to want to serve the communities where we're from, and want to serve the communities that need our support the most. So there are areas that have been overlooked, and it may not be the flashiest place to have a practice, but we still want to make sure that those communities have doctors, and so we tend to fill those gaps. Just a really quick overview of what does it even look like to get to medicine. So in high school, we want to make sure that we're focusing on our sciences and having a strong scientific foundation, taking the classes early. So, once you are in the undergrad pipeline and maybe in doing your pre-med requirements, you've seen this stuff before. So it's not like you're learning it for the first time. In addition, in high school is a good time to build study habits, learning how you learn the best, so that when you get to college and you are focusing on chemistry and physics and biomechanics and some of the more advanced courses, that you are prepared to take on the volume of information that you need to learn, and need to learn quickly. And also preparing for your MCATs, because the MCAT is the exam that you have to take in order to be admitted into medical school. So that kind of gives you a score that is the component of your application when you're applying to medical school. Some of the experience that medical schools are looking for is shadowing experience, going into a doctor's office, maybe joining rounds in the hospital, or watching surgeries. Really give you insight as to what it looks like. Volunteering, coming out to the health fairs, going into communities that need support. Really showing that and being involved in the compassionate side. And a big one is research. There are tons of opportunities to further the science of medicine. And so getting in on a study, and whether it's bench research or clinical research, that can be really helpful, and also really attractive on your applications. Quickly, the timeline, right? Like getting through all of this training and ultimately becoming a physician, it takes a long time. I'm not gonna lie. So after finishing undergrad, or after finishing high school, then you'll start your undergraduate courses. Most people finish their undergraduate degree in 3 to 4 years. And then after that, then you apply to medical school. Medical school is another 4 years. And then after medical school, you undergo kind of complicated process. So I'm not going to go into the details, but the match process, where you pick a residency, and that's where you decide what you're going to specialize in, whether it's surgery or family medicine or internal medicine. You pick a residency, you go there for your specialized training. That typically is anywhere between 3 to 7 years, depending on the specialty you go into. And then, not everyone, but some people like myself will do a subspecialized component of their training. This actually is anywhere from 1 to 5 years. I'm sorry, I got the numbers messed up here. And then ultimately, you got to get a job and you start working as what we call attendings. That's the kind of big girl, big boy doctor in the hospital. And that's it for the most part. Um, I'm gonna take a pause here and see if we've gotten our panelists on.
Yes, we have a few panelists who've joined, all as Dr. Nikki Perez.
Oh,
But we see y'all, so thank you for being here as well.
Welcome, welcome.
okay. So, welcome. I didn't want to lecture any longer, but wanted to have the opportunity to maybe the folks who are here introduce yourselves real quick, and then we'll dive into the questions.
In what
Awesome.
order?
I hear you, Dr. Lang. Do you want to go first?
I just wanted to know what order, but I
Oh,
can. Hi, I'm Dr. Khadijah Lang, and I am a family medicine physician. I'm in private practice in Los Angeles, where I have been in private practice for over 3 decades. And I'm also the president of Golden State Medical Association, which is the California branch of the National Medical Association. And I am Region 6 chair of the Western block of states in the NMA.
thank you, Dr. Lang. Dr. Humes?
Hi, good morning. I'm Dr. Haskell Humes. I've been with Kaiser Permanente for about 34 years after training in physical medicine and rehabilitation and surgery. So surgery at Howard University and then National Rehab Hospital in Washington, D.C. for physical medicine and rehab. And that makes me kind of a specialist in muscle, bone, and nerves. And I like to tell people it's kind of like the intersection of or the overlap put together of orthopedics and neurology is a kind of a way to think about it. We do more nerve stuff than orthopedics, and we do more muscle and bone than neurology. So it's shoulders, backs, a lot of that kind of stuff that we do uh, in my field. And I'm also involved with the Drew Society and vice president of that. I've been that for several years and involved in other activities outside of medicine. But yeah, as to medicine, I think that's what we're kind of sticking to, right, Dr. Perez? Yeah. Okay, that's good.
Dr. Hawkins? You're still muted.
There should be a little microphone button at the bottom of your screen that you can.
How about Dr. Poole while Dr. Hawkins is working on unmuting?
Good morning, everyone. My name is Dr. Renee Poole, and I am a double board certified family medicine physician and lifestyle medicine physician. And I work in managed care. Been practicing for almost 20 years now, and I'm happy to be here. Thank you so much.
Great, welcome.
I think I'm unmuted now.
Okay,
Can you hear me
great.
now? Yeah.
Dr. Hawkins?
Oh, yeah. Radio. So I'm an internist and pulmonologist in Inglewood for 40 years. Previous president of the Medical Board of California, did some work for the Food and Drug Administration, and a long-time member of the Charles Drew Medical Society and NMA. Very pleased to be here, and also chair of the mentorship committee, involved in the membership committee, any multiple committees, and some of the folks we all contribute. Those are part of the Charles Drew Medical Society one way or another. Thank you.
Great. I see quite a few questions in the chat. Do you want us to go directly to those or?
Yeah, I see the chat is going off. So thank you
Right.
for participants for speaking up. But I was thinking maybe just to kick us off a little, we heard a little bit about each of your specialties. So thank you for sharing. I'm wondering if maybe a few of you could maybe just give us a little bit of an overview of just like what a typical day in the life looks like. And I imagine that that can look different from day to day, week to week. But just I know that in previous conversations with students who are considering, they've just been like, what is it actually going to be like? Because as we talk about selecting a major, thinking about getting into a specialty, a lot of our students don't, who especially haven't interned or haven't had the opportunity to connect, don't really know what that looks like outside of visiting their doctor's office. So maybe if you can share a little bit in terms of what that actually looks like in practice for you from a high level.
Can I make a comment because I unmuted myself and maybe Randy Hawkins, you hear me right?
Yeah.
Yeah, yeah. So, I mean, I love medicine. I'll tell everyone on the call, I tell my students who rotate to the office who are in medical school, the medical profession is one of those extremely special professions, and one of those that you have the opportunity to be involved in individual life and give back, often when they're extremely vulnerable. So it's a gift, it's a treasure. Being a physician or a healthcare provider, being a physician that practice medicine is something that's extremely valuable. It comes with a lot of responsibility, but the rewards are very, very significant. And that'd be my um, comments. I'll say from a mile high view that I love practicing medicine. I love being in people's lives. You have the opportunity to be of service when often when they're quite vulnerable, and so take it seriously. And uh, welcome to the club. That's my comment.
Do you
Well,
want
I
to
could
share?
certainly do a little, oh, go ahead. Go ahead. I'm sorry.
No, I was just going to ask Dr. Hawkins if he wanted to share about what a day in the life of his clinical practice looks like.
So, there was that model of private practice. You had an office, and you may have been in or out of the hospital, and you have a specialty or not a specialty. But one of the things with me is I do two or three different jobs. I mean, there was a period of time when I first started practice as a pulmonologist, a part of a big group, and I was critical care medicine. I spent a lot of time in the hospital, and I built a practice through the emergency room and patient self referrals. And that's still something that does happen. You take care of a patient, and you do a great job, and they want you to take care of their brother, their sister, their husband, their wife, etc. So I spend a certain amount of time in my office seeing patients, my own patients and patients that are referred to me as a specialist. One of my other jobs is end of life, and you may find that at some level, particularly when you first start, unless you join yourself employed, unless you're employed by a company, say like a Kaiser, that you might have two or three different streams of income. You may be in practice, you may work for someone else, you may do some ER call. And so one of the things is that I do a fair amount of work with advocacy and public service. And I think that one of the things about that is you never know who you're going to run into when you're advocating, you're providing public service. And so you should take those seriously. You should take the opportunity to be involved. I mentioned I was involved in the medical board and Food and Drug Administration. And so you run into people who you can serve and people who may be an extremely valuable connection for you in the future, who can write letters for you, who can do this to other people. And so I think that that's another thing that I do. Um, I think there's a risk of getting overwhelmed and overextended. And so you have to, as you choose a specialty or career, work-life balance. Medicine is really important, but I'd encourage you to have an understanding of what's important to you and makes you keep yourself in the mix. I'm rambling a little bit because it's complicated, but I think I'll stop there.
Dr. Humes?
Recording in
Uh,
progress.
I'm sorry. I'm just getting off my phone and getting on the computer here. Sorry for this echo. Let me just turn this. Sorry, apologize. So I heard Dr. Hawkins mention Kaiser, and I'm actually somebody who didn't anticipate it at all. Some people think of Kaiser as corporate medicine, and it's certainly managed care and HMO. But I came from Washington, D.C. After not really figuring out what I wanted to do, like a lot of folks. I'm going to get into the day in the life very quickly. But I just wanted to say this. A lot of people think you have to decide what you want to do when you're in college or when you're applying. It's what do you want to do? What kind of, and really that evolves a lot. For me, it changed. And I didn't decide until I got into internship and found out about my field. I didn't know about it. I heard the word physiatry, which is what another term for it. And it sounded like psychiatry, and that's not what I wanted to do or be associated with, not me. And I saw another question I just wanted to say. Black physicians are needed in every field. So somebody asked where we're needed in absolutely every field. We're underrepresented in every field of medicine, and the fields are vast. We are needed in administrative physicians, teaching physicians, faculty, and in every specialty. But so a day in the life for me, really starts off with seeing a lot of lower back problems. I come in and say hi to my nurses. I do have an office, sort of a typical office space there in exam rooms, and so the patients are in the rooms, and they tend to be more spine. So people who have sciatica, pain going down their legs, pain going down their arms, pinched nerve in their neck. Pinched nerves in their wrist, carpal tunnel syndrome, you may have heard about. And then we also do nerve tests throughout the day. We do procedures, epidural injections for people who have those problems with pain going down their leg. And spending, for me, as I do tend to run late with my patients because I spend a lot of time with them, I'm starting to back up. And so when you back up 5 or 10, 15 minutes with these patients, that adds up to quite a bit of time. Sometimes I have to speed that up, but a lot of times patients, particularly who are in pain, which is what I see a lot of, need more time, and they need to talk about more things than just their physical problems. So all of those things are a part of what I do. I like to do the procedures, but I also love the interactions with my patients and the relationships that we built over the years. So, much of it goes to that. We have meetings throughout the course of the day, and, I'll let some other folks chime in here, but that's an introductory, I guess, day in the life. But, there's a lot more to it. I just don't want to talk too long here. As an initial person, Dr. Poole has so many interesting things to say, as does everybody else. So go ahead, please.
Thank you.
Okay, I think
Dr. Perez, would you mind stopping your screen share? That way,
Yep.
Thank you.
did Dr. Humes just call me out?
Not at all.
Well, I'm your primary care doc. So family medicine, we see all ages from the womb to the tomb. So all ages, which I absolutely love the impact you can have on the community. But in my current work environment, I mainly see adults. And the first day in the life essentially starts with a morning huddle with the team. So all of the medical receptionists and the medical assistants, nursing staff, all the docs get together in a room and talk about what we need to do for the day. That usually lasts 10 to 15 minutes, and then we're off to patients. And these patient visits range from any primary care issue, from physicals to illnesses to injuries to abdominal pain to whatever issue you can think of. Your primary care doctor is the first person that you see to help you navigate and improve your overall health and assist you in your health journey. So I love the variety of that. Every visit is different. And also every visit has its challenges. And thrown in there, a lot of people don't realize is that primary care, we deal with a lot of mental health issues too. So throw in physical symptoms, but also throw in mental health concerns. And so that can be very taxing sometimes. And so to answer one of the questions in there, how do you prevent burnout? That work-life balance is so important to keep healthy perspective, to know that you're contributing, and to learn how to have healthy boundaries, and to learn to almost have a shield of protection. I pray every morning to have a shield of protection to not allow whatever negative energy be absorbed, because oftentimes you do get a lot of that because people are coming to you not feeling good, they're sick, having a tough time. And so it's really important to be there for them in that capacity. But it's important to also take care of yourself in the process. And in the middle of seeing patients, we have to respond to emails and test results. and we have meetings. Most of the time they're during the lunch hour. So we have to squeeze in food and bio breaks whenever we can. And as soon as the end of the day is over, I am up out. I will see everybody the next day, and I try to minimize my work when I get home because I have other things to do. So that's pretty much the day in the life of the job that pays me to pay my bills.
Dr. Lang, do you want to share?
Okay. Well, I am in a phase of life. I too am a family medicine physician. I also am obstetrics competence, which means that I also have been trained to do obstetrics and deliveries. I have hospital privileges that allow me to go admit patients into labor and delivery and do vaginal deliveries. If it's a C-section, I first assist on the cesarean deliveries. So in private practice, I pretty much am able to arrange my schedule as I see fit in theory, but in reality, my patients arrange my schedule, just to be truthful. So on a typical day, I go into the office and I will see patients. I do not know from the time I walk in the door what I will be greeted with. I don't know if I'm going to walk in and see a 6-month-old who's coming in for follow-up from the emergency room with an ear infection on Monday morning, or whether I'm going to walk in and see an asthmatic that's in the middle of an exacerbation, or whether I'll walk in and have somebody who's been fully adherent to the recommended plan we've come up with and has beautifully controlled blood pressure and beautiful lab results showing that they're really getting a grasp on how to handle their particular medical conditions. Whether I'm going to have a 97-year-old whose daughter is informing me of incontinence. It's just the variety goes from A to Z and finds a way to get some other letters in between. Don't know how, but it does it. I do usually I try to confine my obstetrics and my pediatrics to one day of the week, but things always creep through. But on my OB day, we call it Peds OB day in my office, and that's when we try to see our children that are coming in for well child visits, immunizations. So on those days, there's a lot of screaming, and there's also pregnant women, but because the pregnant women know they've got a baby in them that's going to be screaming soon, pretty soon, also, they put up with the kids screaming in the room next to them. You get a lot of questions with the pregnant mothers, sometimes generated by seeing or hearing the people in the room next door to them who already have children if they're a first-time parent. And but I would also say that I think it gives the parents a certain level of confidence and comfort that, okay, once I get this baby out of me, I can come back to the same place and be able to get the baby taken care of. So I right now, currently, I am inducing a patient for labor. So at any point, my phone may ring. And one of the things about obstetrics is I've got to be prepared for people to stop me from whatever I'm doing and might have to leave what I'm doing for myself or my other patients. Sometimes that occurs when I'm in the office. Sometimes it occurs when I'm in the bed. Sometimes it occurs when I'm at a meeting or a dinner. But when it happens, I do have to be prepared, and I have to go ahead and leave what I'm doing and head on up to the hospital and handle that delivery. So at this point, I have a lady in the hospital who I'm inducing, which means that at any point in time, over probably the next 36 to 48 hours, because inductions they're not like on TV, they take a while. I need to be prepared that I may stop what I'm doing and say, see you guys later, and head on out to the hospital for my delivery or a complication that occurs in labor. And at the end of the day, I do paperwork and charting and things like that. And then I head on out to my family, which for me includes going to my mother first and then heading on to my family.
Thank you, Dr. Lang. I see Dr. Pyle has been able to navigate the log-on process. Do you want to introduce yourself and share what a day in the life of your practice is like?
I definitely will. Dr. Perez, how's my little grandson doing over there? My little nephew?
He's doing great. He's
Okay.
doing well.
Welcome, everybody. It's a pleasure to be on. It took me a day and a half to get on this, the new Zoom presentation. My name is Orlando Pyle. I'm a graduate of completion of Martin Luther King Charles Drew residency, 1976 to 1979. I was also in internal medicine, and I completed that and went into, I didn't go into private practice right away. But what I did was I did geriatrics and I got on hospital staff at Robert F. Kennedy, which used to be Hawthorne Community Hospital. And then eventually I developed a practice in Inglewood. One of my biggest problems was I couldn't get on staff at Daniel Freeman, and I couldn't get on staff at Centinela Hospital. And the only way I got on staff at Centinela Hospital is I went to the mayor of Inglewood, and I told him that situation, and he called the CEO of Centinela Hospital, and in one day, I was on staff at Centinela Hospital because of those lying suckers were telling me that, they couldn't find my application. Well, that was bull. But anyway, this was some of the complications that I had. And Daniel Freeman said, no, the only way to get on that staff there, I had to be with another staff member. But that's another way of just keeping Black physicians out from the hospital. Robert F. Kennedy was the first one, and they actually welcomed me to be a member. Anyway, so that's where I started in terms of my internal medicine practice. But lo and behold, God has created an opening for me, which was absolutely remarkable. A buddy called me and told me that he was working at the LA County Sheriff Department, the county jail. And I asked him if they had any openings, and he said, sure, I believe so. So I applied, and I became a member of the LA County Sheriff Department while I still had my private practice. And that was in 1986. Well, guess what? Eventually, they asked me to be head of the communicable disease, the TB unit. Now, any resident at King Hospital back in those days, we saw TB every day. Each and every day, we had to do all the smears on the sputum. We had to present this to our chief, the attending physician, etc. Did I black out on it? Can you guys still see me?
Yes.
Oh, well, I can't see you anymore. But anyway, I'll complete with that. So eventually I took over the TB unit, and in about 1988, I had TB patients that were not getting better, and eventually they were AIDS patients. So eventually I went into training for HIV, and I was the first HIV physician from 1988 on. And eventually I became the chief of communicable diseases there. In addition to that, I'm also a member of the HIV Consortium, which is a organization of physicians, PAs, nurse practitioners, that we are not only treat HIV patients, but we also educate not only the community, but throughout the United States and in different parts of the world, which I've traveled to and also presented not only in Africa, but also in the Caribbean. So right now, I completed my practice in Inglewood in January of 2015, after 40 some years of practice. And also I retired from the Sheriff Department in 2015. And I want to say that right now I'm just working with the HIV Consortium and also with Charles Drew Medical Society with the mentorship. And I think that's extremely important for us, for physicians to be a part of that mentorship program and show whatever guidance that we can provide to our pre-med students and high school students, and also to our medical students and residents, because I think our experience is so important for these young brothers and sisters to hear us and to question us, to find out how can they navigate through this crazy world of medicine. And I just want to tell them, for all of the people that are listening, the students, residents, is that we welcome you to ask us for any particular guidance. And I'm sorry that Dr. Jones Staley, and maybe he's trying to navigate to get on this, but this brother and I trained each other along with 3 other medical students at Rutgers College of Medicine and Dentistry. We gathered together and trained each other in the first 2 years of medical school because we found it very difficult. And our camaraderie was so important to educate each other and navigate through our medical school and eventually move on to a successful practice in not only this country, but in other countries. So I think that information is more than enough, besides my lovely wife, who basically is my rock and my foundation to help me through all of this, because we've been married since 1972. And
All
we
right
got some
now.
beautiful children, grandchildren.
Thank you,
Thank you,
Dr.
Doug.
Powell.
Thank you.
Yeah, I'll go really quickly. I know we have a ton of questions
Oh,
in the
go
chat,
for
and
it.
I really wanted to get to that. I do hand surgery. I see a combination of patients in the office on some days. I see a lot of workplace injuries, people who have carpal tunnel, people who got their finger caught in a machine and unfortunately cut the tip off, and stuff like that, people who slipped and fell and broke their wrist. And I do surgery. So if those issues require surgical intervention, meaning they need a carpal tunnel surgery, they broke their finger, they need the finger fixed, they broke their wrist, or they cut the nerve, that sort of thing. I also do microsurgery. But Ivana, I want to let you guide us through.
No. Thank you all so much. And to echo a comment I saw, this is such an impressive panel, and it's really our honor to have you all here, pouring into our students. I see a lot of questions, y'all. Thank you so much. I'm trying to summarize them all that I think hit on some of the top themes. As you guys said, and as you know, we have tons of college students in the room who are early on in this exploring passion for the field. Is there anything that you guys can share as far as what you wish you knew as a college student, especially framing it in that, before you entered the field, which is also wrapping up into the question of what should students be doing now, right? Especially in college and taking the classes that they're taking, the research, the internships. But is there anything that, as you think about your journeys, you wish you knew or were aware of? That would be a great gem for our current students.
I'll say this. Once you get on, if you're in private practice, once you get on staff at a hospital, get on to, or if you take a job with the managed care, get on to a committee with whoever you're working with early on. You get onto a committee, you go to your department meetings for whatever specialty you choose to finish in, get on to the department meetings for your specialty, and get onto a committee, because this allows you exposure. It allows you networking with a community that may otherwise ignore you, and it will allow you to be aware of opportunities that are coming up that you wouldn't have otherwise known about. And it allows you to see, I failed to say I do a lot of advocacy work for physicians and residents and students that get into problems with their credentialing or their licenses. And by being on the committees, going to your department meetings, you get to see what happens when when a colleague is accused of doing something wrong on the inside in the peer review meetings. And then if something should come up for you, if you know that, well, gee, in the last couple of years, Joe Smo was, had this complaint against him, this same complaint against him, and you guys, said that the department chair would have a word with him and ask him to do something differently. And then you did the same thing when Karen had a similar issue. Now, how come all of a sudden when it's Lucretia, now all of a sudden you want to put her off staff and take her license? And you're able to have that historical information to call them to the carpet and let them know, we're watching. We see how you handled it when people who didn't look like us did similar things. And now all of a sudden you want to say, this is the necessary management when the person looks like us. And it does happen frequently. Dr. Hawkins can tell you. But having gotten into those committees, number one, they're going to be less likely to try to bring you up before themselves when they know you're on the committees and they know that information. And number two, it gives you more historical information to work with and better protect yourself and your colleagues when things come up.
Thank you. Dr. Nick, I see your hand up.
I think that the thing that I wish I planned for a little bit more, and I definitely felt like some of my friends did not, is figuring out what you want your life to look like. Sometimes you go after what's the most competitive specialty, what's the sexiest thing, what's the what seems really cool and or maybe really hard, and then 20 years of that just didn't actually fulfill you if you really want to do other things with your life. When I was in residency, one of my attendings liked to surf in Australia. And he went into emergency medicine and he was able to do his shifts at the beginning of the month and then take 2 weeks and then go surf in Australia. And like that made him really happy. So like figuring out what you want life to look like, if you really want to spend a lot of time in the hospital, or if you're like, I really like being hands-on in my office. So just trying to pick a specialty that interests you, but also taking into account what you want the rest of your life when no one else is paying attention to look like.
Thanks, Dr. Perez. And that definitely hits on some of the questions folks had is how do I pick a specialty, right? That's a great place to start, right? Like, what do you want your life to look like? Hey, Dr. Poole.
All right, I'll just add, totally agreeing to what everything's been said thus far. But one thing that I wish I knew earlier on is in medical school, they don't give you the business side of medicine. They give you very foundational things, absolutely, in order to practice medicine, the sciences and how to diagnose and treat and so forth and so forth. But as far as the business side and the politics behind medicine and healthcare, I think it's definitely something that you kind of pick up along the way. And I myself went and got a business degree in order to kind of fill in that gap. Because it was evident of that me, particularly as I moved into leadership positions. And then also the fact that medical school and residency is very foundational, and you have to have a spirit of continuous learning, because in last time I was in training, so many things have changed, right? Even just with technology. So you have to keep up with medicine and all the different innovations that have come forth, and learn in different areas that you might not have been trained in earlier. So you have to have a spirit of continuous learning as well. So, and that's just something you have to also mentally prepare for if you want to appropriately take care of your patients throughout your entire career.
Thank you, Dr. Poole. That. I just wanted to address a quick question just related to what you had mentioned, Dr. Poole, in terms of technology. And I saw a question earlier in the chat in regards to AI. I know that that's a conversation for a lot of our college students right now in terms of ethics around AI, being a college student, and wondering how that, if any of you can speak to briefly how that might translate into your field and any thoughts that you might have around Should they, shouldn't they? How are you?
Go ahead, Dr. Humes.
Okay, I'm sorry, my hand raising function I can't find. I don't usually use this computer. Um, so, yeah, I think part of the question, the first question, if I can answer that first part real quickly, anything I wish I would have known. As I said, I kind of fell into this particular specialty after not deciding in the third year, which is traditionally when you decide after you go through and rotate through the major specialties, internal medicine and surgery and OB and peds and psychiatry. Um, and I was looking at surgical specialties, but I actually personally am profoundly, as are 10% of men, colorblind. So I found, although my first love was surgery, that there might be a little disadvantage there. And I thought I could depend on where things were in the body, the anatomy. But that's not always the same. And so I found myself potentially being at a disadvantage and even further problems potentially with that. So I chose something that I could do procedures in, which I like to do. Those are injections, those are nerve conduction tests, but also have an interaction with patients. In terms of AI, I just put my hand up because at Kaiser, which again, I actually intended to be out on my own. I didn't expect to be at a large place in medicine. I planned to come to California temporarily and then go back east. But once you have kids and you work on getting them in school and your wife is a dentist and she has her practice going, and all plans change. And everybody tells you how good the retirement package is at Kaiser because that's the reputation at Kaiser, although they've chipped away at that some. And we're still, like Dr. Lang, like all of us, trying to advocate, trying to reach as we climb. So I'm always advocating and pushing the medical director and the assistant medical director and the chiefs of the departments to hire more Black folk. But AI at Kaiser, I think the first time I've really been pleased with automation because it doesn't seem to have replaced any jobs. When they first brought on the electric medical record, it knocked out a lot of jobs, people in medical records who were taking the notes and people who handled the charts. There are just a lot of jobs. I had a lot of conflicts about that. But with this new thing called a bridge, which Kaiser has bought into, it actually, I can speak to the patient as we did and not be behind the computer like things have changed. Certainly at Kaiser, and a lot of us are standing behind the computer because we have to get the notes done, we have to get things done while we're seeing the patient. I can go over to the patient and this AI program, after I ask the patient for permission, it puts the note, it transcribes it, but it also organizes it. And sometimes it gets a little bit opinionated or it shortens what I say. So I have to go back and you always have to go back and edit. But my experience with AI, and I decided as I am semi-retired, in my last year, a lot of people passed on it. I said, no, I'm gonna go and grab this thing and make sure I know how to do it because I won't be. It'll continue to evolve, and there's people who are much younger than me who did not, and so they're still trying to learn it now and deciding that it is accurate and it is helpful. So. And then there's certainly robots that are being used more and more. Dr. Perez can talk about that in procedures and surgery and actually, they'll be coming to some of the things I do, like epidural injections, where we put a needle into the spinal canal to help people with their pain. But that's an example of AI, that's largely what I do with my patient because I'm challenged with typing. So I was always had an aversion to typing classes. So that helps me with that. And with my sort of the patient interaction has been helped by that quite a bit as well.
Awesome. I see Dr. Hawkins and then Dr. Poole.
Yeah, thanks a lot. Yeah, my hand function, I don't know how to use it on my phone, but I really want to emphasize a lot of what's been stated already, the richness of the contribution. I would endorse what's been stated. I mean, Dr. Powell talked about limitations in medicine and practice early on, and Dr. Lang talked to us about advocacy and speaking up, and Dr. Poole talked about the business side of medicine, understanding that because if you're in private practice or just you're in life, having the financial responsibilities you have, and work-life balance by Dr. Perez, and actually and you just heard what Dr. Hume said in terms of career selection. I mean, I think that I am very, very pleased and proud of what I've done thus far as an internist and pulmonologist in public service. I think that early on, and when I was in medical school, everybody did a specialty, and I thought that I had an aptitude for surgery, but I didn't get the encouragement from the surgeons. They didn't discourage; they just did not encourage. So what I've done different, I would have explored some of the specialties in greater depth. I would have looked at it and asked myself, do I like this? An aptitude for this, or am I just doing it because that's what people say you should do? I didn't really know about work-life balance, and in the beginning, those in practice over 20 years work really, really hard, multiple jobs. Medicine is tough, and as I said earlier, it's a gift, it's a blessing to be involved in folks' lives when they're extremely vulnerable. You have the ability to make a difference, but it's hard work. And I think that Dr. Perez reminded with her example is that try to know who you are and what you need. And I mean, as a person in the early 30s, I was just thinking about, what am I going to do with this career that I've chosen? And it's not just me. Then you get married or you have a significant other and things change and you have to figure out how that fits in the mix. And so I think that what I hope that you're doing, that you're taking bits and pieces of what we're saying, because there's a certain richness that's being conveyed to you. And I suspect that if you take some notes and think about it, as you go along the way, you'll say, oh yeah, there was that discussion we had with organization, innovative organization, and now I see this. I think this is something that's real. Yeah, use this information so it's valuable for you. That's why we're here. And there'll be other ones as well, but take away from what you can, store it, use it, think about yourself, particularly who you are and what you want and need, at least at whatever stage you're at, and don't give up on your vision, that what you believe you want to be and do. Those are some of my comments about this whole situation, but I'm glad to have the opportunity to be involved in this discussion. Earlier today, I said to Dr. Perez, hey, I may have to bow out because there's always tons of things to do. And sometimes you overcommit, but I'm glad she said, oh, I'm sorry, because that made me feel guilty. And now I'm glad I did. So,
She got you.
She got me. Appropriately so, because I said I was going to do it.
Thank you so much.
My
pleasure.
pleasure.
And Dr. Poole?
Yeah, I just wanted to briefly comment on the AI question. AI, there's a time and place for it. It's definitely beneficial, but I want to caution for it not to interfere with your critical thinking skills. Sometimes, you automatically put in the question in Claude or Chat GPT and it spits out the answer, but you're not using your mind, you're not using your problem solving skills. And particularly with medicine, when you're going through your training, that's critical, and you have to be able to pivot and know how to process different information that's given to you. It reminds me of a mentoring session that I was a part of a couple of weeks ago with some aspiring students that want to go into medicine. And we were simulating a patient interview. And a couple of these kids wanted to use their computer. And of course, I knew what was going on. They were typing in questions and basically asking questions based on whatever app they were using to help guide them in their interview process. And it was a clear difference between those that were using the computer with these question prompts versus the student who actually was listening to the patient and pivoting their questions based on what the simulated patient was telling them. And so use AI to your advantage, absolutely. But we don't want it to replace using your mind and your critical thinking skills, because that's what's going to really be withstanding in all circumstances.
I just wanted to add
I'd
really
like to
quickly
say something. I can't raise my
Go ahead,
hand.
Dr.
I
Lang, I'm sorry.
apologize. But I think, we did talk about work balance, and I'm unable to see the student participants, but I would just say to the women participants on the call, sometimes it can be different for a woman versus a man in medicine. And I think it's important for the women to know that you can, in medicine, you can choose your route and you can choose your social life. Some people wish to remain single, and the practice of medicine makes that pretty easy. In some respects, there's benefits and there's drawbacks to being in a committed relationship. But I think it's important that the women on the line know that you can definitely make your, just like you've heard us all saying how we've come into medicine and chosen different pathways, sometimes not what we initially thought we were going to choose, and moved forward with it and made that work. And you can also choose different social pathways. You can choose to be a single woman in medicine. You can choose to be a married woman in medicine. You can choose to have children or not have children. I spent, I guess, the beginning, very beginning of my studying as a single woman, and eventually I got married, and more eventually I ended up having children. And so I've seen the practice of medicine as a woman from different perspectives, as a single woman, as a married woman, as a mother, and eventually as a sandwich generation with elderly parents and children being taken care of by me while uh, working and managing an office and hospital responsibilities. But I say that to say that you can have what you want and do what you want with your medical career, regardless of where you are socially, whether or not you're single, married, or with or without children. And I think those of us, and it's more acceptable now. When I was doing it 30 years ago, it was like, why is that woman coming into this meeting with that baby? But you just step out there and you do what you're going to do. I brought my children with me. Everybody knows my children because I was constantly dragging them around with me. But if I had something to do, they came with me. My children know the hospital in and out because I would take them with me on rounds. If I didn't have a babysitter, the nurses would be glad to, oh, how cute a baby, So there are things that you can do to make it work. It will be more challenging. It's going to be more of a workload for you. Can't lie about that. It's definitely a greater workload having a family to take care of and be responsible for at the same time that you're taking care of patients who can be very demanding of you, not intentionally, but their needs are very demanding. But it is doable and you can do it. And the rewards, I wouldn't trade having my children for anything now that they're there. When they were coming, I was like, what the heck am I doing here? How did I let this happen? But they're here and I love them, and they have been a wonderful source of joy in my life. And I'm actually at a phase where I'm seeing my children now come back and willingly volunteer to try to do things for me. Wow, praise
That's
God.
awesome.
No,
That's awesome. That's really awesome.
thank you so much for sharing that. I think it leaves us, it answers a lot of the questions in terms of like the work-life balance and the burnout. So appreciate you sharing that, Dr. Lang. I know that we're over time, and for our students, if you have to jump off a little on the hour, totally fine. I just wanted to take this opportunity because we have such an impressive room of Black doctors specifically, and I want to address the question that was put in the chat because of our student population, I know you all can't see them, but majority of our students are students of color as well. And with the question that was put in the chat by at our Los Angeles Community College classroom asking, again, with Black doctors on the call, this is such a unique experience. Can you give any advice around flat out racism in the field? I know that a lot of our students have dealt with microaggression, or not even so micro aggressions in the classroom, and just any advice that you can share for our students from a student perspective, how they might push through. We might not have time for everybody to answer, but I just wanted to take this opportunity with you all being here, and this is such a unique room to address that question. I saw Dr. Williams.
You're muted, Dr.
Okay.
Humes. There we are.
Yeah, so I think, for the college students and those going to college or getting ready to go to college, I think one of the first things, and one of my neighbors tells me I did this when we first started as freshmen, coming from an inner city school. I was in a summer program, the first of a minority summer program where Black and brown students were brought in to get a little bit of a head start on the classes and meet people. And I thought that was invaluable. I had other plans for that summer and being a lifeguard and having fun on the beach with my friends, but my father did the math for me and told me I would need to find a place to stay if I didn't take this opportunity where there was free tuition and board and able to take a class. So that was quite a boon to learn and to meet people initially. I think in deciding what and I guess the volunteerism that we all hear, all these physicians, all these Black physicians here, we all are volunteer. This is all a volunteer activity. We all recognize the need that we have, and we have gotten here, but on top of the shoulders of others. And so we realize that, we understand that. And, I regard it as a commitment. As Dr. Pyle or one of the doctors was alluding to, there's all kinds of things going on, and you have to try to, stick to your commitments, even though they may be volunteer and you've got a lot of different things we've got to juggle. As Black physicians, we have more things to do than the average physician. I always am checking with my patients to see how other patients are being treated by certain physicians who I know have some reputations as not treating our people the same, not offering the same surgeries. You have to advocate for our people with the people who are hiring at Kaiser. So that's one level. There's a cutoff there, cutoff getting into med school, getting into residency, all these different levels that you have to get past as a physician, where advocacy from us, whether it's mentorship, whether it's one-on-one, comes into play. I know we're winding up. I don't want to dominate that. And I did want to add one thing on the AI. I don't use AI to think at work, or to put my notes together. I only use it to transcribe, and it organizes a bit. But in terms of problem solving, which is one of the fun parts of medicine, that's not what I would use AI to try to synthesize. I wouldn't trust it, and I don't think the patients entrust AI. They're entrusting you as a person to gather their information and then put it together and figure out what the problem is and try to treat it.
Briefly, I'll make a comment, Randy, Dr. Hawkins.
Yeah, go for it.
So bias and racism is here. It's real. Notwithstanding what we're told in Washington, D.C., it's real. We see it every day. They're acting it. They're showing us. You do need to know your stuff. You do need to be prepared. You need to know what you're supposed to know to be in the room as a student, as a resident, as a physician. But you have to find your advocates where they are. There are advocates there. And you have to be cautious about who you can trust initially, but you have to find who are the people with the strength and the advocates who align with the way you think. Knowing your stuff, finding your advocate, and then holding the institutions to what they're responsible to do. But I think those are all 2 and 3 important parts of this question of being able to stand your ground, to require institutions to not work against you or treat you in a negatively different way than the other person, your colleague, et cetera. But you do have to know your stuff. And advocates, we're all here for that. Those are my comments.
I'd like to make some comments on the racial issue. Number one, as a college student or a medical college student or pre-med student or high school student, if you're in a background, an educational environment where you're in a minority and don't have faculty that look like you and are being treated differently, I would say, first of all, one thing I learned early on, I failed to tell you, I am a proud graduate of Fisk University and HBCU in Nashville, Tennessee. And while at Fisk as a chemistry major, I took up a dual degree in engineering, which meant I had to go to Vanderbilt for my engineering classes. And I learned early on at Vanderbilt that when I would get there, if I asked a question in class or if I asked a question after class, the professors would just be like, oh, that was covered in the reading. Make sure you go do the reading. And then if a student of another persuasion asked a question, they would, very similar to mine, they'd get a 5-minute explanation. So what I started doing was, because I was at that point in my career, I wasn't ready to try to fight City Hall. I was just trying to get through there. So what I started doing was sitting at the front of the classroom, right in front of the teacher's desk. And then after class was finished, I would sit there, quote unquote, gathering up my papers and my books and my backpack and getting myself situated. I was really just listening to what he was telling the other students who would come up and ask questions, because that way I was able to hear the responses fully and also know what my other colleagues in class didn't know. But I was able to hear his responses fully because I could that he was not about to answer me. Moving forward, and in the anticipation that you guys will get into medical school or you'll and into a residency program, I would say protect yourself. Prevention is, my grandmother would say, an ounce of prevention is worth a pound of cure. For those of you that don't know, there are 16 ounces in a pound. That means it's 16 times more powerful to prevent than to try to treat and cure. When it comes to medical school and residency, document, document, document. And it may seem the most minute thing, minutia, but when the dog starts biting, you'll be so glad that you had that spray. As an example, a lot of times in residency, there's a noontime lecture that residents are supposed to come to, and it's understood that this is something you should come to if you're able to, but you've got responsibilities 24/7 when you're in residency, and you've got to take care of your business first. I started coming to the conferences when I could come. On those days I was not busy taking care of patients in the hospital, I would come over to the department and sit in the noontime lecture. And I started writing down what time I came in, who was in the room with me. I just used initials. I wasn't writing a whole test, but I would walk in the room and I would sit down and take out my little spiral notebook that I kept in my pocket and write down June 24th, A, AGPR, QT, whoever, the initials of whichever of my colleagues were also in the room. I wrote down who was already in the room. I wrote down what time I walked into the room, and then people who came into the room after me, I wrote their initials. Sooner or later, sure enough, I got called up. I was the only Black person in my residency. I got called up by the department chair that, we have a problem. You're not attending the noontime lunch meetings, and this is an important part of your education, and this is a problem, and we have a problem with you not coming. And I was like, oh, okay. And I went and pulled out my little notebook and I did the statistics, and I came back and I told them, X% of my colleagues do not show up. If you'd like to pull the sign-in sheets, I'd be happy to point it out to you. But because I came out there with direct percentages, that said to them, oh crap, she's got something on this already, or she wouldn't be able to make such firm statements. Just documenting. If you're on rounds, documenting by, even though you don't have a license, if you're in a rotation, you write something in the chart. Oh, I heard the attending say we're going to increase the IV fluids. I'll put an order in the computer to increase the IV fluids, and then wait for the attending or the intern or somebody to sign off on it. But you've now documented that you were there at those rounds because you put an order in the chart. Therefore, you were there, because people will come back. I was told as a resident, oh, well, you haven't been here. We haven't seen you. I was like, really? No, where were you looking? I mean, I'm kind of hard to miss. I apologize, I'm not on camera right now, but I'm a Muslim woman and I wear hijab. So you can imagine that a Black woman in hijab in most medical schools and residencies in America would kind of be obvious. I stand out. They can't miss me. But people would tell me I wasn't there. And then I would go and pull charts and say, well, the attending signed off on me writing this note during those rounds and on this note during those rounds. I'm not sure why you didn't see me, but yes, I have been there. So I didn't really make a big fight about it. I just came prepared with documentation that made them have to back off when they brought things up. I would always prefer the polite route to take because I knew odds were stacked against me.
Yeah.
But
Dr.
That
Lang,
was
I
just the
think
way I
we're
meant
over
it.
time. I hate to cut
Okay,
you off,
I'll
but
finish it. I stop.
thank you.
You're welcome.
I did want to give a chance to Dr. Poole. I see your hand's been up.
Yeah, I mean, on the topic of racism, first and foremost, all the isms will be there. Anytime that you are different from the general population, someone is going to always say something or have a personal opinion or have personal preferences. And sometimes it'll be microaggressions and sometimes blatant racism or acts of discrimination, which particularly in healthcare, in any field where you are serving the community. So it's really important to have a strong sense of self because you will continuously be under attack. And that can easily destroy your self-esteem and your self-worth. And so having a strong sense of self, having a strong support system, having a place so you can get affirmations and encouragement along the path is very important, just so you can continue to sustain and move forward.
Thank you, Dr. Poole. And Dr. Perez to wrap us up.
Yeah, I'm so grateful for the community that I'm in, and I hope that you guys see that there is community in this space and that you never feel that you're alone in that racism. So I know there were several comments about mentorship and how finding other organizations, but look for, there are Black doctors, there are communities of Black students. There's the Student National Medical Association, which is the medical student component. There's the MAPS chapters of the SNMA, which are the undergraduate organizations that are available. So make sure that you're connected. If you're having trouble finding people, you can reach out to us. These organizations are all over the country. So as has been said many times, the racism, the isms are there, but you don't have to do it alone, and figure out how you want to navigate it. Everybody's not a social justice warrior picketing, but how you want to navigate and finding support for that is really important. And reach out to us. Everyone's here. Our panelists enjoy doing this work. We enjoy pulling students along, and if you see someone who looks like you, who's doing what you want to do, reach out. And I guess the first step was being here. So thank you
Yep.
guys for coming. Thank you for being interested. All the questions were awesome, and really, really engaging, and very fulfilling for us.
Thing.
Thank you so much to our
Definitely, definitely.
panelists.
Thank you.
And it's
My
Um,
pleasure.
to say it shows really that you all are passionate not only about your work but pouring back into the community as well. So thank you for being here on a Friday. And to all of our students, I know if you had to jump off a little bit earlier at the 11 o'clock mark, but we just had a few quick wrap up things that we would like to take care of. So for our participants, as you know, we always do a wrap up survey. So please scan the QR code. I think Ivana was going to put the link
I
in.
put it in the chat already for folks, so please make sure that you fill that out. As you know, we always listen to the feedback that we get from students and love to share. So also wanting to remind folks that on July 24th is our next session, Money Matters, your next chapter. Folks had really good questions about money and like, how do I keep myself out of debt and all of these things. Please come to our next session because we'd love to just cover that, foundational, now that you folks are in internships, jobs, all of those pieces. So please make sure that you continue to register for our remaining Summer Glow Up series. But we'll see you July 24th. If you wanted to send this recording or session to our to your folks in your network, we also have our YouTube. Please make sure you follow us. And we're very excited again to continue to bring this programming to you folks, but especially today, we hope each of you feels more inspired and feels like they have the tools, but also, starting your network here of folks who have been there and are extremely successful in healthcare because they found a way to make impact. But also, as you heard, right, that work-life balance, that finding a meaning for yourself. So again, thank you to our panel. Thank you, Dr. Perez, for bringing us all together. And we'll see you folks at the next one.
Thanks, everyone. Have a great
Thank you.
weekend.
Bye-bye now.
Thank you. Bye-bye.
Bye-bye. Thank you.
Thank you. Bye-bye.
Thank you.